Sure. I have a Master of Arts in Counseling Psychology from UBC, and I'm a registered clinical counselor here in British Columbia. I have 16 years experience counseling children and families, and I currently work here at the ABLE Clinic in West Vancouver in private practice. I work with children, teens, families, parents, and about 95% of my clients have anxiety, so I spend a lot of time supporting people with anxiety, teaching them strategies. And I also run groups for children to teach them about anxiety and anxiety management strategies. And I also write a blog once a week for parents on my website, SharonSelby.com. Anxiety can develop for many different reasons. It can be a combination of environmental, genetic, psychological factors. Quite often, if one parent has higher than usual levels of anxiety, then a child may also show that and just be more vulnerable to anxiety. It's not always the case, but it's quite common. Also, children who are more highly sensitive tend to have higher anxiety. Sometimes it can be environmental stressors that bring on the anxiety. Sometimes it can be a specific event or illness. And there's also some medical conditions that bring on anxiety, such as diabetes or asthma or heart conditions. So there's many different reasons one could have anxiety. What's really important is to recognize the signs and the symptoms and to get help, because anxiety does grow and it does tend to spread into other areas of one's life. Yeah, I think it's really important to minimize children's exposure to the media whenever there are troubling events such as earthquakes. The visual images can be really difficult for them to process and understand, and can leave imprints on their mind that can give them nightmares. And then even hearing the information on a radio or just hearing the news in the background can also be very distressing, because some of the details are too much for children to hear. So I always recommend that parents really filter that and summarize to a child what they need to know, telling the truth but not including the upsetting details. Yeah, so I think it's really wonderful that the schools in particular do a great job of training children to be ready for an emergency through their different drills, the earthquake drills and the fire drills and things like that. But if a child becomes overly anxious about emergencies happening, then to help calm them, it would be good to use evidence. So remembering that anxiety is about thinking of all the worst possible case scenario and fear of what can happen in the future, you could look at the data from your region, and you could see, when have different natural disasters happened in history, or how often has it happened. And so this would help to make the child realize that even though an emergency could happen, the likelihood of it happening tomorrow, for example, would be very low. And also reminding them that we're prepared. We have our emergency kit in place, we have our plan in place, and we know what we would do. So just really using the facts and using the evidence to help them to stay more in the present.